They suggest that regular ejaculation, especially in your 20s and 30s, may lower the risk of prostate cancer later in life. While more research is needed, the evidence points to a clear potential benefit. Frequent ejaculation, whether through masturbation or partnered sex, can be a natural way to support prostate health. As men age past their 60s and into their 70s or 80s, maintaining overall health becomes more complex. A lifetime of habits, chronic conditions, and social expectations all influence how we age. One area of health that is seldom discussed openly is sexual well-being and self-stimulation. This aspect of men's health often carries stigma, yet research shows that maintaining a healthy connection with your sexual self can have broad benefits. When a man engages in sexual activity, whether with a partner or through self-pleasure, his body undergoes a cascade of physiological events. Testosterone, a hormone critical for maintaining muscle mass, bone density, and sexual drive, is released. Oxytocin, sometimes called the cuddle hormone, is released as well, which calms the nervous system and reduces stress. Endorphins, the body's natural pain relievers, elevate mood and can ease aches. Regular sexual activity also increases blood flow throughout the body, not just to the genitals. Blood perfusion to the brain supports cognitive function, while improved circulation to the heart and muscles supports cardiovascular health and mobility. Maintaining this circulation is like keeping the engine of your body well-oiled. Neglecting it can lead to stiffness, reduced function, and faster decline. Sustained sexual activity has been associated with several tangible health benefits in older men. Longitudinal studies tracking men from their 50s into their 70s have shown that those who remain sexually active tend to have lower rates of heart disease and score better on tests of memory and executive function. Regular orgasms may strengthen the immune system through temporary increases in white blood cell activity and reduction of stress hormones. Feelings of pleasure can also improve sleep quality, which in turn supports hormone regulation and reduces risk for chronic diseases such as diabetes and hypertension. Despite these benefits, many older men disengage from sexual activity. There are several reasons for this withdrawal. Cultural messages often suggest that sexuality wanes after a certain age. Some men internalize the notion that masturbation is shameful, or that erections should be as spontaneous and robust as they were at 30, and any deviation is a sign of failure. Physiological changes such as slower arousal, reduced firmness, and longer refractory periods are natural consequences of aging, but they are frequently misinterpreted as signs that sex no longer works. Psychological barriers also play a role. Feelings of guilt, religious prohibitions, past trauma, or fear of intimacy can suppress sexual desires. Furthermore, chronic health issues may interfere with sexual function. Diabetes, hypertension, cardiovascular disease, prostate enlargement, and medications used to treat these conditions can reduce libido or erectile function. Managing stress through meditation, deep breathing exercises, yoga, or counseling can keep stress hormones like cortisol and adrenaline from interfering with sexual arousal. Third, embracing self-pleasure as a tool for well-being requires removing stigma. Self-stimulation is a normal part of human sexuality across the lifespan. It allows men to explore what feels pleasurable in a low-pressure environment. It can also help maintain pelvic muscle tone and erectile tissue health by regularly filling the corpora cavernosa with oxygenated blood. Using appropriate lubrication, setting aside private and comfortable time, and approaching the experience with curiosity rather than performance expectations can foster positive experiences. Finally, open communication with partners and healthcare providers is essential. If you have a partner, discuss your desires, fears, and needs with them. Sexual intimacy is often more fulfilling when both partners feel safe and understood. If you use any medications or supplements, inform your doctor to avoid interactions or side effects. Avoid unverified products claiming to restore vitality. Many supplements marketed online are unregulated and may be ineffective or harmful. Remember that there is no single blueprint for sexual health. Aging affects each person differently, and what works for one man may not work for another. The key is to view sexual wellness as part of a holistic approach to health. Attend regular checkups, stay physically active, nourish your body with wholesome foods, manage stress, and maintain connections. both emotional and sexual. By doing so, many men find that they can preserve their vitality well into advanced age, enjoying not only longer life but richer quality of life. Consultation with urologists, endocrinologists, and certified sexual health counselors can provide personalized strategies tailored to individual medical history and goals. Above all, remember that pleasure and health are interconnected. Honoring your sexual self is a valid and valuable part of caring for your whole being.